The difference between acupuncture and biopuncture is that acupuncture originates, of course, from China. So we can consider it as a Eastern medicine or Chinese medicine per se. But biopuncture originates from Western, especially from Germany. And by the word acupuncture, we are using acupuncture needle to treat a specific illness or disease by unlocking or unblocking the flow on the blockade of the specific meridians. While biopuncture, we are using biological medicine as physiology regulating medicine to be injected into reflex zone, trigger point, or acupuncture point. So they are both complementary, but we are much dependent on biopuncture because it uses biological medicines as homeopathic medicine. The content, of course, on pain management is different from organ stimulation because we are using the Tromil, Zil, and the Spascopil as a common, but it depends on the site of the injection or the complaint of the patient. If it is neck, entire spine, or the sacral, it varies from indications. But the most common is the Tromil, Zil, and the Spascopil. It contains 70 plants and minerals, the cocktail of these three ampules. And it is generally safe because it is homeopathic, meaning the most diluted substance. It came from plants and minerals. Just injecting a minute amount just to elicit a bystander reaction for the management of pain or for distant organ stimulation. So maybe 0.2 or 0.1 is enough just to make a bystander reaction. The common observation on my patient is that if it is chronic, maybe more than a month, it may require 2 sessions, but if it is acute or less than a month, maybe 1 session is enough. But if it is more than a year, it depends on the response really of the patient. Biopuncture originates really from Western. As a matter of fact, Dr. John Kershot is the proponent of this therapy. So it originates from Germany, while the acupuncture or puncture originates from China. So merging these Western and Eastern modalities is beneficial to all kinds of patients, especially those suffering from chronic and acute pain, or if the organ of the patient is already toxic or weakened. So we can use biopuncture to stimulate the organ to regain its function. But the most common indication is for the acute and chronic pain management.
My health is very good. I can even walk. I can even medyo madalas nga lang medyo nananakit yung kaliwang binti ko. I'm also suffering, hindi ako makatulog ng maayos sa gabi. Tapos nangangalay na I'm very painful talaga na hindi ko maano kung gaano kasakit siya. Biopuncture for me is very good to my health condition. Maganda siya sa katawan at maayos yung pag-alaga sa akin ng doktor. Pinayon sa akin na mag-undergo nito dahil una-una na nakita sa akin katawan na medyo may impairment ako, may tabingi daw yung lakad ko, tapos medyo nakita na sa akin na medyo may kakaiba sa posture ko. This is my second session actually. First session is also good. I feel better and comfortable. I can also even walk normally. I can feel the progress in my previous one. Feel very comfortable now after maybe this. The doctor said this around 4-6 sessions to be undergo this kind of treatment. And then I feel now very comfortable. I feel easy to walk now.